Temperatures cool and people gather for the holidays. COVID-19 cases and concerns are increasing. And as Nancy Cordes explains, the White House is renewing some of its efforts to stop the spread.
Congratulations on your first dose.
With 90% of the country now seeing a COVID surge, the administration is reinstating its free testing program. Starting today, Americans can order 4 COVID tests per household at covidtests.gov. According to the latest CDC numbers, COVID cases are up nearly 50% in the U.S. in just 1 week. COVID deaths are up nearly 62%.
Why are COVID deaths spiking more dramatically than COVID cases are?
Death numbers are just beginning to rise. We obviously want to make sure that does not go any further. We know we can prevent nearly every death from COVID if people get their updated vaccines and people get treated.
But so far, fewer than 16% of U.S. adults have gotten the new bivalent booster released this fall. Among them, Denise San Miguel in Dallas, who is acting now because her sister got COVID.
I was just scared that I don't want to get it.
Even before this COVID uptick, hospitals were already overcrowded with flu and the respiratory illness RSV. Though on that front, the White House COVID coordinator says there is a bit of good news.
There's still places that have very high levels of RSV. But nationally, there's no question in my mind RSV is heading down.
Nancy Cordes joins me now for more from the White House. Nancy, President Biden is pushing for people to get this bivalent booster, which reminds me of the last time he was pushing for people to get the booster. It seems like they've been doing it for a while. It hasn't been taking. What's going to be different now?
Well, they're going to send Dr. Jha, the COVID coordinator, out to the briefing room more often to remind people that this is a serious situation. They're hoping that when people see some of these truly startling figures with COVID cases doubling just in 1 week, and we're not even into the heart of winter yet, that people will, sort of be shaken awake and realize that they need to get a booster if they haven't gotten one already. They're also doing a few things to make it a little bit easier for people to get boosters, particularly the most vulnerable population, which is the elderly population. They're expanding the pool of individuals who can provide those booster shots. So, for example, currently nursing home staffers are not part of that pool. They're going to change the rules so that they can provide shots to individuals who are living in those nursing homes, just to make it a little bit easier for that population to get their shots.
And I thought I heard Dr. Jha say that the reason the tests had been delayed, the new tests that are going out, that the White House announced today, that they had been delayed because they didn't have money. Is there going to be enough money delayed during the summer so they could be sent out in the winter because they didn't have enough money? Is the money going to be there for this new push?
That's a great question, John. It doesn't look like it right now. You're right that the White House had this free program where you could get 4 COVID tests by going to covidtests.gov, but they wrapped it up in September, partially because COVID numbers were improving, but also partially because they realized that they had to hold some of these tests in reserve for the possibility of a winter surge, and they just didn't have an endless supply of money to pay for those tests. And so now they're kickstarting it again. They've asked Congress for $9 billion more dollars to help fuel the COVID operation, not just for tests, but for all kinds of things. And right now, Republicans are really pushing back hard. They say that the government has already spent too much money on COVID prevention, COVID relief, and they say that if the White House needs more funds, then it should repurpose them from somewhere else. White House is arguing they've already done that, and they're running out of places they can go to. But this is sort of one of those classic Washington stalemates, and as of right now, it's hard to see how this gets resolved.
I feel like, Nancy, you and I are going to be talking about Washington spending stalemates for many, many months to come into the new year. Nancy Cordes for us at the White House. Thank you, Nancy.
You're welcome.